Hello, we're group 2, and my name's Angie.
I'm Shirley.
I'm Jugja.
I'm Gazelle.
I'm Jocelyn.
And today we have Bacterial Battle, the path to promotion. Game overview. Welcome to Bacterial Battle. You and your friends are aspiring microbiologists hoping to find their niche working in a hospital. You are all required to know a lot about a variety of topics in microbiology in order to advance in your careers and be promoted. There will be 4 different paths leading you to your promotion at the hospital that focus on the following topics: aspects of bacteriology/virology, immunology, antibiotic resistance, and diagnostics/treatment. The game will help players actively recall these concepts.
The game consists of 4 players and the target audience is 16 plus. Contents. There's going to be 1 game board, 1 cheat sheet, 45 cards with 5 decks, 4 characters, and dice. How to win. The first player to reach the hospital at the center of the board game by getting correct answers wins the game. About the cards. There will be 4 decks of cards numbered 1 through 4, which match up with the numbers 1 to 4 on the dice. There will be special cards with a question symbol, which will have case studies. These special cards will be pulled if you get numbers 5 to 6 when you roll the dice. The special cards serve as a boost or opportunity to advance 2 more spaces if you get the answer correct. Setting up. The game board needs to be on a flat surface. The deck of cards have a designated area on the board as well as a special deck. The characters will be set at the end of their chosen path.
Each player will be able to choose a character from the ones shown up below, and each player will be able to roll a die. Depending on the number that the dice lands on, you will pull from that corresponding deck. For example, if I roll the dice and I get number 3, I will pull from deck number 3. And if you roll the dice and you get number 5 or number 6, I will pull from the special deck card, which are the case studies.
If you're pulling cards from decks 1 through 4 and answer the questions correctly, you can advance depending on the number of the deck you drew from. If your answer is incorrect, you will remain in that space. When answering the case studies, if the answer is correct or for the most part correct, you are able to advance 2 spaces. But if your answer is wrong or you can't answer, you will remain in the space you are currently at and place that card at the bottom of the deck. Some tiles can be tricky, so watch out. They may say move back 1 space, roll again, or skip turn. If you land on skip turn, you will sit out on that round.
Okay, so now we're gonna demonstrate how the game would be played. Each player will now select their characters.
This one? Take out this.
And each character will be placed at the end of a path. So now the first player will roll the dice.
Four.
Since I got number 4 on the dice, I will pull from deck number 4.
And the question is penicillin more effective against bacteria that are gram-positive or negative?
Gram-positive. Now since I got the question correct, I will be able to advance 1 space
4.
forward. Oh, 4 spaces forward, I am so sorry. And I landed on go back 1 space. So,
Yeah.
Okay, ready?
Alright.
next person will roll the dice.
5.
Since we landed on number 5, we have to pull from the special deck, which is a case study.
A 43-year-old woman complained of fatigue, nausea, and abdominal discomfort. She had a slight fever. Her urine was dark yellow and her abdomen was distended and tender. Serological assays demonstrate the presence of immunoglobulin IgM antibody to the hepatitis B core antigen, HBsAg, and the presence of hepatitis B surface antigen, HBsAg, and the hepatitis B antigen, HBeAg. She also had IgG to hepatitis A virus. How does serology define the course of this disease? And how is the infection transmitted?
So serology defines the course of the disease by looking for the presence or absence of antigens in the blood, and the infection is transmitted through contaminated blood. Correct?
Yes.
All right. And how many spots do I move?
2.
2. 1, 2. Go back one space. So I go back here.
Yes.
And we also do have one person who has the answers that's not answering the question to make sure everyone's getting the questions correct or incorrect.
Okay. 4.
Which drug-resistant infection is the leading cause of bacterial pneumonia and meningitis in the United States?
What was antibiotic resistance? Is it Streptococcus pneumoniae?
Correct.
And now, because I got it correct, I advance 4 spaces. 4. What are the little dice?
Roll again.
Little.
Lucky you. Woo. Yay.
Okay. 5.
Yay. Lucky day. Case
Special
study.
day.
A 28-year-old man has had severe complaints. He had a bad case of thrush and low-grade fever, had serious bouts of diarrhea, had lost 20 pounds in the past year without dieting, and most seriously, he complained of difficulty breathing. His lungs showed a bilateral infiltrate on radiographic examination, characteristic of P. Girovici pneumoniae. A stool sample was positive for Giardia organisms. He was a heroin addict and admitted to sharing needles at a shooting gallery. What laboratory tests could be done to support and confirm a diagnosis of HIV infection and AIDS? Also, how did this man acquire the HIV infection? What are other high-risk behaviors for HIV infection?
Presence of HIV plus T level CD4 cells decrease. ELISA and P24 protein. And for the next one, needle sharing and unsafe sex.
Correct. Since you got the question right, you will move forward 2 spots. And we place the question that was correct at the bottom of the deck.
Okay. 4. Okay. What do MDR and XDR stand for?
I don't know.
Because she doesn't know the answer to the question, she loses her turn and will remain in the same spot on the board.
Okay. 3. What are the 2 ways P. aeruginosa can be diagnosed?
PCR and blood agar plates.
Yes.
So it's
3.
correct. I move 1, 2, 3. Since I landed on skip a turn, I will sit out on the next round. Wah, wah, wah.
Okay.
All right, next.
2. Immunology. Describe immunodeficiency and one disease it can lead to if severe.
Immunodeficiency is when the immune system isn't able to help defend the body from foreign or abnormal cells. Example would be a patient that has frequent or recurrent pneumonia, bronchitis, or even meningitis.
Correct.
Because I got the answer correct, and this was from the deck with the number 2, I move forward 2 spots. 1, 2.
3.
Name all 3 antibiotics that treat M. pneumoniae. Then came the one antibiotic that is only used for children with M. pneumoniae. So you have to name all 3 antibiotics that treat M. pneumoniae and name the one antibiotic that's only used for children with M. pneumoniae.
Microdoil and I don't know the other ones.
Because she cannot recall the names of all 3, she would just remain in the same spot.
Okay. 6. Because we rolled a 6, we pull from the special deck. And it is a 26-year-old Marine recruit presents to the base medic with large pus-filled lesions by arrhythmia on both legs. Infections with Staphylococcus aureus is suspected. What structural properties are unique to the species of Staphylococcus? How do cytotoxins produced by these organisms produce the clinical manifestations seen in this patient? And resistance to what major class of antibiotics is now common in community-acquired infections with S. aureus?
So does the structural properties are coagulase protein A, species specific tiochoic acid, and the clinical manifestations seen in this patient are S. aureus can produce a number of cytotoxin, including alpha toxin, beta toxin, delta toxin, gamma toxin, and pantone valentine. As in for resistant to what major class of antibiotics is now common? Penicillinase resistant penicillin, including methicillin, oxacillin, and nalficillin. Yeah, Staphylococcus resistant to these penicillins.
Okay, that was correct. So because you got them right, you can move up 2 spaces.
Now, since I landed on skip a turn previously, I have to sit out on this round.
Okay. Ready? 6.
Wow, I sure am lucky.
A 36-year-old woman with urinary retention, pelvic pain, and fever presented to the emergency department 6 days after transvaginal oocyte retrieval and embryo transfer for male infertility. The computed tomography scan revealed large multi-oculated pelvic and tubo-ovarian abscesses. The woman improved after drainage of the abscesses and antibiotic therapy. Gram stain of the abscesses Abscess material revealed a polymicrobic mixture of gram-positive and gram-negative bacteria, and both aerobic and anaerobic bacteria were recovered in culture. What are the most likely anaerobic bacteria in this infection? What antibiotics are usually active against B. fragilis?
Since I do not recall the answer to that question, I will not be able to advance forward, and we'll move on to the next person. But at this point, that was just a quick demo of how to play the game, and we're gonna end it off there. Eventually, the goal is to make it to the middle, and the first player that enters here will win the game. Thank you for watching our demo.